Hello, we are live on this Viome webinar event today. We are so happy to have you all here today to spend the next hour with us for introducing Viome's oral health solutions. And so while we wait for just a couple more minutes for everybody to come on into the webinar room, I would love for you to find that chat over here on the right and let me know what your name is. Excuse me, and where you are logging in from, because we very famously have people from all over the world join us. And Mitchell, I see it says that the sound is off. And so if you just want to take a look at the note that I have up here in the chat, which if you're having any audio or visual issues, try refreshing your browser and closing any other tabs that you have open. So we have LaShawn from Montana, Carrie from Washington, Isabel from France. Excellent. All the way, now we're already across the world. Here we are, Sun from Tampa, Michelle from Northern California, Adam from Montreal. Now we're in another country too. Lisa from Indiana. And then RL from Dallas, Texas, Yuri from Romania. Excellent, more Europe, fantastic. Joan from Canada, Joni from Cleveland, Ashok from New York, Sandy. Well, I mean, geez, it just goes on and on and on. I'm so excited to have all of you here today. It just keeps on coming in. We're having more and more people come on in today. Barbara from New Jersey, Paul from Washington, Kareen from Washington, Lynn from Indiana. Welcome to all of you. So glad that you could spend the next few, let's see, quarter hours with us. We're probably going to run about an hour here. We have a lot of speakers here. As you can see, I'm very excited about the talk that we are going to have today about Viome's oral health solutions. And Judy from Los Alamos, New Mexico. It's 11:07. I think it's probably time to get started here. And I would love to get started first with some formal introductions with the other people that I have here on the stage. And first up, if everybody wants to wave as I announce your name, I have Dr. Stephen Barrie, our VP and Head of Clinical Nutrition. Hello. And I have Dr. Guru Banavar, our founding CTO and Head of Discovery AI. Welcome. And I have Dr. Grant Antoine, our clinical nutrition team member here. All right, thank you. And then a new face to our webinar stage, I have Dr. Edward Zuckerberg, who is Chief Dental Officer for Viome and has been a pioneer in the integration of technology in the dental office for over 30 years. Welcome, gentlemen, here today. And so we waited for just the right time to talk about this topic, and it is the time. The planets are aligned. It is National Dental Hygiene Month, and we wanted to have that backdrop because to discuss the importance of having a healthy mouth. Not only fresh breath, it's not only about fresh breath, which is important, but a fully healthy mouth and oral microbiome. Because as we are finding out, a lot actually, it's connected to whole body health. You see it in the headlines. The mouth is the gateway to whole body health. And I think the American Dental Hygienists Association picked October in particular to recognize Dental Hygiene Month because what happens in October? Well, we happen to celebrate Halloween, sometimes a whole month long, usually with lots and lots of sugar and candy. And while we do love it, well, I love it, our body doesn't always love it. Would you say that that is a correct statement, Grant? Our body does not like sugar or microbiome?
I think that's pretty correct. It's like alcohol, right? It's a lot of fun, but probably doesn't do much good for any of us.
Some of our microbiome likes sugar, and that's the problem. Then they tell us that we should eat more sugar.
Yeah.
Well, you know, I mean, it's just the way it is, you know, and I do think that is a strategic month, October being, you know, Dental Hygiene Month. So this is a perfect time to talk about this. And I would really love to move things on and give the stage to Dr. Stephen Barrie to talk about our latest Viome intelligence test, which is the Oral Health Intelligence Test. So Stephen, please.
Thank you, Lisa. And I want to congratulate everybody that's listening in because you're taking time out of your day to learn more about something that can improve your health today and improve the health in the future. So we appreciate the fact that you're sharing your precious time with us. And Lisa, in terms of Halloween and candy, I'm one of those parents. Our kids are not allowed to have candy, and they still talk about it 35 years later that they were the ones who weren't allowed to have candy on Halloween. So anyway, I thought we'd start with making sure we're all on the same page, and we're going to talk about the microbiome, right? To make sure that everyone understands what that is. So the microbiome, all these small little creatures, bacteria, viruses, fungi, protozoa, they live everywhere in the world. They live in the air. They live in the soil. They live in our water. They live on plants. They live on the bodies of all animals, and they live inside the bodies of all animals. And without the microbiome, life on Earth could not exist. There's more microbiome than everything else on the planet by weight. So they're important for plants growing. They're important for making beer. And as some of you know from we've talked about in the past, the microbiome in our gastrointestinal tract, they're important for how our bodies function. Many of you know Viome doing the pioneering research in the gastrointestinal microbiome, how that affects the health of our bodies, both in terms of the GI tract and in terms of very systemic chronic diseases. And in the past few years, research has now centered on what's happening in the oral cavity. And it turns out that there are, 1,000 or so species of microbiome bacteria that live in the mouth, and they both help to have a healthy oral cavity, and they're part of having an unhealthy oral cavity. The key that has evolved in the research is that what's happening in the mouth is not just affecting the mouth. It's not just affecting your cavities. It's not just affecting the inflammation of your gums. It's not just affecting your breath. Through various ways, which we'll talk about later on in the webinar, it actually connects to the rest of your body. If you have leaky gums, if your gums are inflamed, bacterial products or bacteria can translocate across your gums and go to the rest of the body. You can swallow lots of bacteria going into your GI tract, which can cause problems. And just to give you an idea of the severity of what oral health does, and we're talking about oral health as the foundation to the health of the rest of your bodies, just on the right of your screen, you'll see, I'm just going to read these because they're so incredible. Women who have poor oral health have a 7 times increased risk of adverse pregnancy outcomes, preterm birth, low birth rate. I mean, every woman who is pregnant or about to get pregnant should have an oral health test to understand what's happening with oral health and then take measures to improve the oral health. If you have poor oral health, you have a 50% greater risk of developing cancer. And that's just not oral or esophageal or lung cancer, it's colorectal cancer, pancreatic cancer, breast cancer. So if you have poor oral health, you have a 50% increased risk of developing breast cancer. Diabetes. 95% of Americans who have diabetes also have periodontal disease. Alzheimer's. You're 70% more likely to develop Alzheimer's if you have gum disease for more than 10 years. You have a 12% higher risk of premature death in women who have a higher incidence of periodontal disease. So all these times that your dentist and hygienist have been asking you to take care of your teeth, brush more often, floss, use a water pick, come in for your at least your yearly health checkups and teeth cleaning. It wasn't just about to have clean teeth or lower your cavities. It actually was affecting the rest of your health, and that's why it's so important. This is why Viome is now concentrating on getting this message out to everybody. So the obvious things influence poor oral health, high carb, high sugar diet, stress, poor oral hygiene, smoking, too much alcohol, certain kinds of toothpaste and mouthwashes contribute to it. The mouthwashes that have alcohol in it or that kill all the bacteria in your mouth. It may help your breath momentarily, but it's killing all the, not just the bad bacteria, but the good bacteria. Okay? So if you have bad breath, bleeding gums, mouth sores, frequent dental issues, these are the warning signs. And this can have a big impact on your overall health, with memory loss, bone loss, joint health, pregnancy outcomes, digestive issues, all start in the mouth. So we really need to pay attention to our oral health. Again, not just for whiter teeth, not just for your breath, but if you want to lower your risk in some very simple way of virtually every chronic disease, you want to take care of your oral health. As I mentioned before, it's not just for fresher breath. That's the least of the importance of having good oral health. So I'm going to turn it over now to Dr. Banavar, who's going to give you more details on what's involved in your saliva sample.
Thank you, Stephen. And again, it's so great to be with you all today. And as the Chief Technology Officer of Viome, I wanted to give you a little bit of what is going on under the hood, so to speak. When you send in your saliva sample, what exactly do we see in your saliva sample? Now, it is true when people say that your mouth is like a mirror of your entire body. In fact, we see an entire universe of information within a single saliva sample. So when you send your saliva sample, we can see a ton of information about what's going on, first of all in your mouth, but also what's going on potentially across your entire body. So for example, we talked about the microbiome just now when Stephen introduced it, but it turns out we can see thousands of organisms that could potentially be in each of your different oral cavities. And we can see not just bacteria, which of course all of us are interested in knowing more about. We can see viruses, we can see these phages, also known as bacteriophages, which infect bacteria. We can see fungi, we can see archaea, all kinds of eukaryotes. These are all different types of microbes that are making, some kind of activity and doing things in your mouth that could result in all kinds of different things. It could be either commensal, it could be neutral, or occasionally it could be harmful. So you need to know what are all of these organisms doing. Not just the fact that they're there, but what exactly are they doing? And in order to figure out what they're doing, you need to know what are the genes that they are expressing. In other words, what are the biochemical functions that are currently active in your mouth? And it's not just on the microbial side, as we've been discussing with the microbiome. Every time there is a microbial activity or a biochemical function that is expressed by a microbe, there is a reaction from your human cells in your oral cavity. So that dance, or occasionally a battle that happens between the human cells and the microbial cells in your mouth, is the critical place where health and disease both happen. So it's important for us not just to know what are the organisms, it's very important for us to know what are the biochemical functions. And that is what we want to see in saliva. And turns out saliva is one of the best samples to see this type of biochemical activity in your mouth. There are many different ways that we could have seen the biochemical activity, such as by looking at your subgingival area, your supragingival area, buccal area, under the tongue, over the tongue, behind the tongue, etc., the throat swab, and etc. We did a study where we took samples from all over the different geographical areas of your mouth, and we found that saliva samples have a very high degree of, first of all, richness of the amount of information we can see, and second of all, reproducibility of that information over and over. If you take the same, samples from the same person, we can see the same types of activities over and over in a reproducible fashion. So we think that is in fact one of the best ways to understand what is going on in your mouth. Now, let us think about how dentistry works today. When you go to your dentist, or when someone offers a salivary test, they may talk about a few factors. For example, they may talk about P. gingivalis, or they may talk about Fusobacterium nucleatum. These are all individual microbes, and people typically talk about a few such microbes. That's what people talk about when they talk about salivary testing. But Viome is taking this type of salivary testing to a whole new level, which is, what if we could see everything, not just the 5 or 10 or 15 organisms, or maybe sometimes simple proteins like MMP8, which indicate some kind of reconstructive activity that's going on in the collagen, meaning it's just, tissues being reconstructed. Those kinds of things are very sort of, simple and specific functions that people see in today's world. But what if we could see everything that was going on? We see every single type of organism. We see every single type of biochemical function, as I said before, meaning you see the transcripts, the gene expression, you see the proteins that are being translated, and then you see the metabolites that are being generated. What if you could see literally everything that is going on in your mouth? And that is in fact what we do in Viome. So we look at your RNA, meaning your gene expression in the mouth. And we're not just looking for certain genes or certain organisms, we're looking for everything that you can possibly see. And we're not looking at just the DNA, because DNA does not change. As you see in the picture on the right-hand side, you take a person who is healthy one day and then who has an inflamed gum in a few days. It's the same person, meaning it's the same DNA. But when that inflammation happens in the gum, turns out their RNA is very different, meaning even though they had the same genes, very different genes are expressed when you're healthy versus when you're sick. So RNA actually measures your health status, not just saying that this is what is in your DNA that is a potential, but it says this is what is actually going on. For example, inflammation going on, or some other activities that may be going on. So this is what Viome's technology, also known as metatranscriptomics, that's what that technology is able to detect all of the RNA gene expression from both your microbes and from your human cells. Because of the amount of data that we are able to detect and quantify, we have to use artificial intelligence and machine learning algorithms on a computer in order to understand and quantify the biological pathways. So we talked about sugar earlier in the Halloween season. So what happens in sugar is that there's a number of different kinds of saccharides, monosaccharides, disaccharides, and polysaccharides, which could be in your oral cavity. By the way, it's not only because you have consumed sugar from your Halloween candies, but also, like Stephen said before, if you had diabetes or pre-diabetes, there's an additional amount of sugar in your mouth. And those sugar molecules can be converted into organic acids by many different bacterial functions. Again, I say bacterial functions, not by bacteria alone, because these are specific genes that may be expressed by bacteria, which can promote adhesion, which can promote growth, which can promote some kind of signaling and an imbalance in your pH. And once that happens, these saccharide molecules are converted into organic acids, and that can chip away at your enamel in the teeth or in the bone, and that can cause cavities, and that can cause caries. So that is why sugars are not good. And in order to figure that out, what are these functions, we use our AI algorithms to analyze many different data points that we see in your mouth, in your RNA gene expression, and then we figure out what is the level of expression of the entire biological pathway. And this way, when you get a product like the Oral Health Intelligence of Viome, you get a number of different scores. You get an oral health score, which is the top level score about your overall oral health, but that is broken down into functional pathway scores related to your teeth health, related to your gum health, related to your breath health, and related to all of the pathobiont activity that's going on. And pathobionts are just pathogens that could be occasionally harmful, but most of the time commensal. We call them pathobionts. And all of that information is provided to you in the scores that is available to you in this product. So because we have so much data and we are able to evaluate and quantify these pathways, we are able to connect these data points And we are able to tell what is going on, not just in your mouth, but also in the entire systemic health processes within your body. In fact, we have information from a lot of people about what kinds of symptoms or diagnoses or drugs and lifestyle that they're following. So we have already made the connections between these oral health scores that I talked about on the previous slide to their systemic health issues. And we can see the direct connections in our own Viome data that Stephen was talking about earlier. We see that in our data. And so the thing I want to leave you with is a single simple message, which is that a lot of the oral health discussion that is going on in today's standard of care is based on science from a long time ago. And that science has evolved, the science has improved, and we should not just believe the science that was in vogue several years ago. We need to see what the science and the data says now. And what it is saying now is the result of advances in technology such as the metatranscriptomics and such as AI and machine learning that gives you visibility into all kinds of health issues that may be going on in your mouth. And I'd like to pass it to my colleague, Ed Zuckerberg, who can give from his dentist perspective what all of this means. So over to you, Ed.
Thanks, Guru. Thanks for the overview, and welcome everyone. For years, dentists relied on looking with the mirror in their eyes, sticking probes, which is not everyone's favorite thing, to basically get a feel for what's going on with the teeth. And, nowadays, we are in this new world of ours. We have the ability with molecular analysis to get a deeper understanding of what's going on in the mouth beyond just what we can see, feel, and touch. Recently I had a physical at my physician's office, and while there was some hands-on stuff, including listening to my heart, blood pressure, cranial nerve tests, EKG, stuff like that, the vast majority of that appointment was spent discussing my blood work. And I was thinking to myself, wow, wouldn't it be great if dentists had the insight into what's going on in the mouth that physicians can get on what's going on in the body from looking at the results of blood work? And the good news is we can. And Viome is leading the way to giving us these insights into what's going on in the patient's mouth and potentially affecting their whole body. So, as mentioned, and you can't, unless you're living in a tree somewhere, you can't avoid seeing articles in the news linking oral health or poor oral health to many systemic diseases in the body. In my role with Viome and as an advisor for many other startups in the oral healthcare field, I've been exposed to a lot of literature, a lot of research showing different pathways, not just implicating, but actually defining pathways for how that happens. So, for example, bacteria from the mouth, their DNA of this bacteria have been found in the brain of nearly 100% of autopsied Alzheimer's patients. How did it get there? And what is the connection? Obviously, we now understand that one of the body's vital defenses to an influx of bacteria into the brain is called the blood-brain barrier. It kind of keeps our brain and spinal cord and nervous system sterile, so to speak. And yet, certain bacteria have toxic proteins which can travel through the blood away from the gum tissues and actually cross the blood-brain barrier. Once they're in the brain, those toxic proteins are interfering with the connection of our neurons in the brain, leading to dementia. in the liver of our body, we've been able to study and confirm that the toxic proteins of the bacteria coming from the mouth are inhibiting glycogen synthesis. Glycogen is our basic lifeblood energy food. It comes from, the necessary sugars from the foods that we eat to provide energy to our cells that allows us to carry out our functions of life. And when our body is working normally, the pancreas is measuring how much sugar is in the blood and directs the body to produce a certain amount of insulin to help the process of converting that sugar into energy for our cells to use. When there is gum disease with bacteria circulating, or the toxic proteins of bacteria circulating, we've shown impairment of that breakdown of glycogen. What that means is that the correct amount of insulin, which the pancreas is directing, is not being adequate to convert the sugar in our blood to energy. So Stephen previously mentioned the connection between periodontal disease and diabetes, well documented, and we've been able to see that when people's gums are treated, their severity of existing diabetes cases are reduced. With effect to heart health, we've known, and most of my colleagues and I have discussed very sad cases where young people with very bad periodontal disease that didn't have it treated, would develop heart disease. I've witnessed patients in my practice actually having heart attacks in their 40s when they have ignored their oral health. And generally, what we now understand is that this same process of circulating bacteria and toxic proteins going through the vessels, the blood vessels in the body, cause weakness in the blood vessels. And our body's response to the weakness in the blood vessel walls is to produce calcifications. Those calcifications are narrowing our blood vessels, leading to high blood pressure, which ultimately can cause heart attacks and strokes. So the connection between what's going on in the mouth and what's going on in the rest of the body is indisputable. And our focus now is how can we really basically provide our patients with the understanding of this situation so that we can then empower them to take charge of their own oral health, and in so doing, protect themselves on their entire body health. And, for years, myself and my colleagues kind of are fighting a battle trying to convince patients about the need to keep their teeth and gums healthy. And for whatever reason, periodontal disease is very insidious. I mean, it often doesn't hurt until the late stages of gum disease. Our teeth aren't loose. Many of us are not aware unless someone tells us that we have odor coming from our mouth that is a byproduct of the bad bacteria in the oral microbiome. And as dentists, we have a hard time convincing people who are not fond of going to the dentist to start with, that they need periodontal care. And even those that we treat in periodontal care or with periodontal care often don't understand that it's not a one-time treatment. Periodontal disease, which affects over 50% of the population over age 30 and over 80% of the population over age 60, is a disease that once with you is always with you. And the approach up until now has been treat the plaque, treat the tartar, instruct the patient on proper oral hygiene, and kind of send them home and tell them, you know, you have periodontal disease, plaque and tartar is going to recur. Please brush and floss well, but you must return every 3 months to, you know, remove the redeposits. What we have now is the ability to empower our patients during, you know, if they're coming every 3 months, that's 4 days out of the entire year that the dental office is creating a pristine condition in their mouth. The other 361 days a year, things not so good. So we need people to take charge of those 361 days or all 365. With the Viome tests, we're going to give you insights into your oral microbiome. And why is the oral microbiome important? Well, our mouth is basically populated with a variety of organisms. Many of them are beneficial and many of them are harmful. And there are certain conditions in the mouth which favor the growth of the bad bacteria versus the good ones. Conditions such as an acidic pH. And I know we've had some chat in the chat room about people who are mouth breathing. The role of saliva as a buffer to the pH of the mouth is critical. So people who have dry mouth, be it from mouth breathing, be it from an autoimmune disease that they may suffer, be it from a side effect of medications they're taking, many of which have dry mouth as a side effect, those people have a propensity to an acidic pH, and that's something that Viome is able to address with custom probiotics, which Grant will be up next and talk more about, which can basically, what we want to do is we want to empower patients to do everything they can through diet, through hygiene, through supplements to promote the growth of a healthy oral microbiome and suppress the unhealthy oral microbiome. And with that, I'll turn it over to Grant.
Hey guys, can you hear me? Lisa, are you there?
I'm here and I can hear you.
All right, all right, all right. Well, you made it to the end. This is the final section, and what I think maybe the more fun section, because we get to talk about Viome testing, oral health intelligence, and what you can expect on your journey. I just kicked myself out. Can you hear me?
Yep, we're good.
Okay, sorry. Yeah, I left the stage. So oral health intelligence, what can you expect? Hopefully you can expect a happier and healthier smile for the whole family. I love this picture here. Really, we just want to give you a brief overview of what the oral health intelligence test is, what the experience will be, and really we just want to make sure that you're informed and know what differentiates Viome's oral health testing from other options out there, because there are other options, but we certainly offer more value in my opinion. So we're going to talk about how easy it is to collect, the timelines for the customer journey, and what to expect in terms of the results and recommendations. We also want to introduce, we're really excited about our new My Biotics Oral Lozenges that we're really excited about. And so here we go. Next slide. So you can see here, this is a little mini timeline. You can see the steps for oral health intelligence testing after you've received your kit. First, you'll register your kit and complete a brief questionnaire to tell us a little more about your oral health history and health details like your current medications, allergies, dietary restrictions that we want to consider to fully and truly personalize your nutrition recommendations while staying safe and effective. Then you're going to collect your saliva sample. It's a simple 1-tube saliva collection. It truly only takes minutes. The lab doesn't need much volume. You'll collect that first thing in the morning before eating, drinking, or brushing. We have tips in the instruction manual for those of you that struggle with saliva production. But once you've collected your sample, you just seal it up and throw it into the prepackaged envelope and drop it in the mail. From there, you can expect your results in about 2 to 3 weeks after you've mailed it. The lab's current turnaround time is an average of 10 days, and they're pretty darn quick. And then what do you receive in that timeline? Both your oral health scores and your personalized food and supplement recommendations. And this is where we feel Viome really stands out. No one else is offering the same level of insight into your oral microbiome. Guru just spoke a lot to the science. Both Steve and Ed spoke to the importance of the oral microbiome and oral health. And no one else really is leveraging the oral microbiome or your oral health through nutrition. Many are still stuck in that antimicrobial mouthwash, kill them all mentality, which really it's an artifact of the antibiotic era where we overly and often inappropriately prescribed antimicrobials without considering the downstream consequences. Very similar to the opioid epidemic, right? We make these mistakes, we learn from it, and we move on. But it's just now beginning to hit the dental community. But let's talk a little bit more about the oral health scores. Sorry, I'm having slide issues. So we spoke a lot about the science. Guru spoke to the science behind the oral health scores. I'm not going to get into the nitty-gritty details here, but it's important for you to understand what results and insights you will receive after testing. As always, we use a score-based system to make sure the complex biology supporting the scores are both approachable and actionable. And everything's conveniently delivered to your device, your mobile device, for easy access wherever you might be. I think it's worth repeating here that the scores are assessing both the presence and activity of microbes in your mouth, right? Microbes that are known to either harm you or protect you. And like Ed said, modern dentistry, it's really focused on microbes that harm, hence all the antimicrobials, but your protective commensal microbes are just as important, if not more so. And these scores, these oral health scores, consider both sides of that coin and really provide information that's more a call to action than anything, right? These scores they're functional in nature. They're not meant to diagnose or treat disease, but what they're meant to do is measure and leverage the oral microbiome to support and protect your oral health. And this is very different from the kind of sit and wait mentality that Ed spoke to that's common in dentistry. Wait until you have a cavity to drill and fill, wait until you have pain, wait until your gums have receded to the point you need a graft or dental implants. We want to be proactive with our health, and we want to be preventative, and the microbiome provides the information on how to do that. So you're going to receive your dental health scores, excuse me. We're going to look at microbes that increase or decrease the prevalence of cavities, activities that promote that cavity production, and microbial activities that influence the local pH, right? That pH balance is very important, and tooth health is really all about deposits and withdrawals, right? And just like a healthy checking account, we want to make sure that we're making more deposits than withdrawals. And pH and acidity really plays an important role there. For your gum health score, we're talking about microbial activity that breaks down the protective layer of mucin that covers your gums, right? The gums are meant to be a barrier from the outside world and protect us. And then they have another layer of protection on top of that, but we can measure the microbial activity that's degrading that protective barrier. We're going to assess pro-inflammatory pathways that also degrade and damage the gums, those pathways that are associated with gingivitis and periodontal disease. For your breath, we're going to look at that breath odor. Microbes play a huge role in breath odor. And you can ask anyone suffering from halitosis who's literally done everything they possibly can in terms of hygiene and dental care to resolve this issue, but they just can't gain any traction. They can't break free. This score really assesses that microbial activity that contributes to bad breath, and then more importantly, provides insight on how to resolve it. There's so many more scores, oral pathogen activity, LPS production, so much more. Really too much to cover here, but for those of you that want to know more, once you get your results, you'll be able to read the score descriptions for each score in the app for more details. And once you have your scores, you'll know the opportunities for improvement, and that's when your nutritional recommendations are going to come in. Again, in the spirit of prevention and protection. So you're going to receive your personalized food recommendations. Until now, the only food recommendation you've really received for your oral health is to avoid sugar, right? But because, again, we're measuring the oral microbiome, there's so much more we can do to provide personalized food recommendations. And just like the gut microbiome, right? It's almost common household knowledge now that diet influences the gut microbiome, but people don't really connect that to the oral microbiome in the same way. But there's the same capacity to influence that oral microbiome, and we look at that. This is where we dig deep, and there's some key differences because foods are just being introduced to the body, and there's very little digestion occurring in the mouth. And there's some chewing and mastication and saliva, some initial carbohydrate enzymatic activity. So the bioavailability of some of these nutrients isn't as high, and so we need to look at what we call free nutrients, free amino acids that are immediately available for microbes in the mouth. And it's an important distinction when you're thinking about how to leverage foods and drinks and diet really to influence that microbiome. So we've done that work. We've mined the literature to provide an evidence-based approach to supporting the microbial environment there in the mouth. And we use the scores and their features. We're able to give food recommendations that do everything from affecting microbial composition, balancing that pH I talked about, protecting the gums. And it really comes down to providing the microbes with substrates that influence their metabolic outputs and activity, right? We're targeting those microbes. We want to use them as a tool to protect and preserve our own health. So instead of that sugar molecule, we're going to provide a polyphenol, or we're going to provide an amino acid that helps to cross-feed bacteria to feed other beneficial bacteria that are productive, or produces a compound that buffers that pH. It's really exciting stuff, and I encourage you to dig into your food recommendations. The reasons behind each food linkage and each recommendation come along inside the app. You can click on those. Double click, do a deep dive. You're going to see articles that support that, from the literature that support that recommendation. It's truly fascinating. Next slide. So then from foods, you're going to also receive your precision supplement formula. These are your personalized supplements. These are going to be your capsulated supplement recommendations. Really, these help to target the upstream and downstream activity of both the oral microbiome and oral health, right? Ed just spoke a lot to the systemic effects of oral health on your whole body health. Kind of the same idea for gut health we talk about, like what's happening inside the tube, what's happening outside the tube. It's the same for the mouth and the body. And in oral health, when we're talking about oral health, we're talking about heart health, we're talking about gut health, brain health, immune health. So what vitamins, herbs, minerals, nutrients can we bring in to really preserve that oral health and protect us against any negative activities that might be occurring, right? What anti-inflammatories can we provide to put out that fire that might impact your bones or cardiovascular disease? What nutrients can we bring in to help with the remineralization of teeth, our vitamin D, vitamin K, calcium, magnesium, all those come into play. How can we manage stress and balance that sympathetic and parasympathetic activity that impacts saliva production and digestion? There's a ton we can do to complement the food recommendations, and it's all there. It's manufactured on demand with exact control over the dosages and ingredients that are going to be in your formula. Again, just really amazing stuff. And then finally, what we're most excited about, our new Biotics Oral Lozenges. We're really excited about these. I'd like to give a quick shout out to the clinical nutrition team and the supplement teams for their effort in bringing this product to fruition. It was truly a team effort. I especially want to recognize Hillary Kaiser, who she's really put her heart and soul into these products. Her passions really shine through in terms of the final product, its quality. She's been a champion for clean ingredients. So thank you, Hillary. Thank you all. So what are we talking about? What are these lozenges? These are personalized lozenges. They're packed with clinically backed ingredients just to support your oral health. And what lozenge and what ingredients you're going to receive, it's going to be determined. It's going to be driven by your scores. It's going to be driven by that microbiome activity. And your formula, your lozenge may be very different from your family and from your friends. And the lozenge platform, it's very important because it allows for the introduction of these live probiotics and nutrients directly to the oral cavity, right? We just mentioned the capsulated supplements. None of those nutrients are immediately available to the oral microbiome, right? They're capsulated. We're going to swallow those. They're going to go to our stomach, go down the path. They're great ingredients, but conversely, you've got the lozenges where we're going to put these in our mouth and they're immediately available. They're going to have an immediate impact, and they're an excellent solution for oral health. And how do you do them? How do you use them? You're gonna brush, you're gonna floss, you're gonna perform your normal hygiene routine, and when you're done, you're just gonna pop in the lozenge. It's like a mint. You can let it dissolve, and while you hold it in your mouth, the ingredients go to work, and they immediately begin to influence the oral microbiome and the activities in the mouth. What are they doing in there? They're helping with the colonization of those protective commensals we've been talking about. They're going to help reduce that gum inflammation, decrease the growth and abundance of periodontal pathogens and those microbes that are promote cavities. They're going to work against the development of dental plaques, which is amazing, right? Even more so, we have ingredients that are clinically proven to reduce the incidence and frequency of sore throat, pharyngitis, and ear infections. So they're going to boost your natural immune system defenses, help you maintain that upper respiratory health, neutralize bad breath. We were talking about halitosis. We're going to leverage those microbes and affect their activity. And again, just an overall comprehensive solution to both improve your oral health and your oral health scores. They do all this and more while using those clean label ingredients I mentioned. You're not going to find any dioxides, any stearates, any sulfates, parabens, artificial sweeteners, none of that junk. So you've got the confidence that you're making the best possible decision in choosing oral health products for you and your family. They're truly revolutionary. Like Ed said, we want to take control of the other 360 days of the year, right? Those days that we're not in that dental office. We want to take control of our oral health because it truly is our full body health. I don't know what else I could say. They're amazing.
All right. Oh, yeah. Oral health. You know how, but are you doing it? I'm just jumping in here because I know I'm going to be giving away something. Do you want to talk about this for a moment, Grant?
I do. The team, we put all our minds together. We talked about doing that research and looking at the evidence base. We put together our recommendations for oral health, things to look at in your oral health products. What ingredients should you be looking for in your toothpaste, for example, or which ones should you be trying to avoid? Lots of tips and tricks in there that you won't just find at your average dental office. So really exciting. We want to make sure we're providing a comprehensive approach to your oral health. Again, protect those teeth, protect those gums, protect those smiles.
Yep, getting some good oral hygiene for yourself here. And besides this PDF download that we're giving to you now, which was put together by Grant and the other members of, and also Stephen as well. Sorry, I didn't mean to leave you out there, Stephen. Our clinical nutrition team. I also want to extend to everyone a special offer to all of our attendees today, which is a discount on or any oral health intelligence solution. And what that is if you visit our website, you can purchase a bundle, which is the oral health intelligence test along with a supplement or a lozenge subscription. And I would like for you to use the code OCTWebinar, and I'll give you a handy link for it very soon, so you can just click on it and just go and purchase, and you can get 15% off for 3 months on any new oral health intelligence solution that you purchase. And the offer is good through October 29th, so that's this Sunday. And so I am going to give you guys a link for that. And if you want to click on that here, what that does, that sends you to our website. And depending on what kind of pop-up blockers that you have, it should send you directly to our Oral Health Solutions page. But if it doesn't, that's fine. It will still have that discount code attached that should automatically be in the checkout cart for you when you check out. You can do that there as well. And that is for you to use with our gift to you as the attendee today. And I want to thank you for spending the last hour with us. And I saw fast and furious, everybody answering a ton of really, really fantastic questions in the chat. Thank you, gentlemen, for doing that. And thank you, Amanda, as well, for answering some logistics questions there in the background. And I want to thank Guru and Ed and Stephen and Grant for giving us a great presentation on oral health intelligence and putting this focus on oral health, the oral microbiome, and whole body health as well for Dental Hygiene Month or oral health, or it's Dental Hygiene Month, sorry, for October. All right, so I'm going to close this down. And thank you, gentlemen, for giving us your time and giving us your expertise. I want to say goodbye to everybody today. Have a wonderful, wonderful day. And you too, gentlemen, have a wonderful rest of your day.
Thank you, Lisa.
Thank you very much, everybody. Bye-bye.
Bye-bye.
Thanks, guys.